Well, there are two other. We talked about the federal programs, and certainly you made mention of your firm or firms like your firm, and that would probably be a non-federal program. And doing drug screens for those, we use the same procedures and the same techniques of collection, but we don't. It's a non-federally controlled program, and so a medical review officer is most of the time not required unless there's a positive. And we have some companies that want a medical review officer to evaluate all their policies and some that don't. But certainly the information is very helpful to the employer. The other thing that we do, that we talked about, are random selection lists. We keep those we keep these groups of employees per company in either a pool with other companies, or if a company's big enough, then their own selection group. And once a month, or once every 2 weeks, or once every quarter, depending on the protocols that the company wants us to set up, we'll generate random lists and then monitor the compliance of those random lists as the people submit themselves to have someone collect the specimens.
Okay. I see. So basically, yes, not everything needs a review officer, but you are one. And it's almost like, going to a professional who is highly qualified, maybe slightly overqualified. Personally, I don't believe in the term overqualified, because why wouldn't you want to have the best qualified person to evaluate even the good cases? In fact, I have noticed that the highest quality professionals in any field, they kind of get the most tough cases, but they also get the easiest cases because everybody wants to go to them. Why?
That's true.
Why exhaust 5 other professionals, and say, well, if it doesn't work, I can always still go to this one. Why don't right away go to this one? Because here's the funny thing, and you tell me whether this is different in your case. The highly professional usually isn't really all that much, if at all, more expensive.
I agree 100% with you. Certainly our rates are very competitive, and we certainly price our drug screens along with all of our other services in a manner that is related to the volume of business that we get from the employer. And so we try to make it to their advantage to give us all their business, and so we certainly do discount some prices there depending on the volume of business that we get from any employer client.
Okay.